Welcome to the Hoag Health Information Exchange. During today's demonstration, I'm going to cover searching for a patient within ProAccess, printing a patient's results or reports, and navigating a patient's chart in ProAccess. I'm going to first begin by logging into the application with my username and password. After logging in, I'm taken to what we call the storefront page. In the upper right-hand corner, I'm going to click on ProAccess. I'm now going to be taken into what we call the clinical inbox. In my clinical inbox, I can see my most recent results and reports in which I maybe have been the ordering physician, I may have been CC'd, I have some type of relationship with this particular patient. If you notice in the upper right-hand corner, the print icon is grayed out. If I want to print this patient's results and reports, I can go to the left of the patient's name on the left-hand side here and click this checkbox. If you notice now in the upper right-hand corner, the print icon is now bold and active. This will allow me to print the patient's results and reports. If I would like to navigate to a patient's chart, there are a few ways to do so within ProAccess. If I'm here in the clinical inbox, I can click on one of these type icons, which will take me to the patient's chart. I have a little manila envelope down here that will take me to the patient's chart. Or in the upper left-hand corner, I can search by patient name. I'm now going to search by a patient name. I've been given a match, and I'm going to click on the patient's last name. I've now been taken to the patient's Encounters tab. Within the Encounters tab, I have the ability to see a number of different items. I could see a patient's Hoag lab results, radiology reports, and recently added cardiology reports. In addition, I have the ability to see the patient's reference labs. At this point, we have over 500 providers sharing reference lab data with Hoag. Reference lab data comes from LabCorp, Quest, and West Pacific Medical Labs. If you notice on the right-hand side here, I have the ability to see this particular radiology report. If I would like to print this radiology report, you will notice that the print icon is grayed out. If I go and navigate to the left-hand side here, I see an encounter date, this little plus sign. If I click on RAD, I now will notice that the print icon is bold and active. This will allow me to print this particular radiology report. If maybe as an example I wanted to filter to look for something different or maybe expand my date range, I have a number of different items and drop-down menus here on the left-hand side. I'm now going to navigate to the right tab here, the Test tab. The Test tab is very similar to the Encounters tab. However, one thing that you're going to notice that's a little bit different, where you had previously seen an encounter date on the left-hand side here, you now see a particular test name. This will actually allow you to look for a particular test by name and maybe the particular frequency of that test. If you notice, this very first example was a cross-match. This test was done on 7/2. But maybe there had been historical data. Maybe that cross-match had been done on May 1st, April 15th. This is where you could go to sort, for example, by test name. Maybe if you wanted to look specifically by type, once again, there is some filtering criteria over here on the left-hand side that will allow you to look, for example, by type. To the right of the Test tab is the Documents tab. The Documents tab allows the user to look for CCD documents. CCD is what we call the Continuity of Care document, also known as a summary of a patient's visit. In this particular example, we see that there was a CCD on 7/3 and 5/16. By clicking on the summary, I now have the ability to look at this Continuity of Care document or the summary of visit. I'm now going to navigate to the middle tab, what we call the Meds tab. The Meds tab is where I have the ability to see the patient's ambulatory medications. If I click on this Update Meds History button, It's going to send out a search to pull back the patient's ambulatory medications. As an example, maybe the patient had something they picked up something at Rite Aid, CVS. Maybe it was a mail order pharmacy. That is where I could see this particular information. Here is in the Meds tab. This is a test patient, so I'm not going to be returned any medication data, but this is an example where I can see a patient's medication data. To the left of the Meds tab is the Reports tab. This is where I can see dictated transcribed documents, and soon we're going to be adding GI reports. To the left of the Reports tab is the Face Sheets tab. The Face Sheets tab is going to give me a lot of different information. It's going to give me the patient's admitting diagnoses, admitting final diagnoses, the demographics. It's going to give me problem list, procedures, and insurance information. Now to the left of the Face Sheets tab is the Patient Info tab. This is a quick summary visit for a particular location. So it's going to show me the demographics, the guarantor, but it's not going to be specific for a visit. However, it is going to give me the most recent information for the profile at that particular facility. This patient has only been to Newport Beach, so they only have one profile. If anyone has any questions about navigating through a patient's chart or obtaining a ProAccess account, I'd like to invite you to contact the HIE team at 949-764-5151 or visit our website at hie.ehoag.org. If you're having problems remembering your username and password, please don't hesitate to contact us, and we'd be happy to help you. Thank you and have a great day.